But let's talk about prevention, if you don't mind, just stepping
Sure.
back, because I really feel like understanding what to do to prevent a disease is just as much as we need to,
Definitely.
we need to know as much about that as we do about treatment. So prevention, when I call it the good things in life syndrome, and I know that bites, but the good things in life are some of the things that can make it worse. So hot foods, spicy foods,
Really?
yes, extremes of temperature, like
my gosh, seriously. Hello, listeners. Welcome to the brand new season 7 of Doc Talk Live. I feel like it's been a while for me, so I'm very excited to be back on this show. Doc Talk Live is a health show dedicated to educating its listeners about different health topics every week. We do so by bringing on our medical experts to answer commonly asked questions. So be sure to send your questions through Facebook Live on Wednesdays at 5 p.m. You can find more information about our show on Facebook, Instagram, Twitter, YouTube, and our website, Doc Talk Live. That's DOCTALK Live.com. Also, watch more episodes of the show on platforms such as our podcasts that can be found on Spotify and Stitcher, and also we're on iTunes and iHeartRadio. Again, my name is Dr. Sylvie Simon, and I am hosting today's show. I am very pleased to have on our show with us Dr. Dornicia Carter. She is a board-certified dermatologist.
hello.
And we will be talking about the topic of dermatology, which is the study of skin, hair, and nails. So I'm very excited about this topic. It's a topic that I rarely know much about at all, but as a kidney doctor, somehow my family keeps to ask me about skin disorders. And I was like, that's not my thing. So I'm very glad that Dr. Carter is with us in the studio today, and she's going to tell us about very common skin conditions that are out there. So Dr. Carter, please do introduce yourselves. Introduce yourself.
Well, first off, thank you so much for having me on the show again. So I was telling everybody before we started today that I was invited to the show back in 2013, and I was pregnant with my first child, and it's really an honor to be invited back. So as Dr. Simon mentioned, I am a dermatologist. We study and treat diseases of the hair, skin, and nails. And so if you have issues with any of those conditions, we're the place to go. I have been in Dallas, obviously since 2013, but actually since 2011. And I recently started my own practice, Affinity Dermatology, in Frisco, Texas, just north of Dallas.
Excellent. Well, thank you so much, Dr. Carter, for being back. And let's just get started because there's a lot of skin topics out there.
Indeed.
In fact, April, believe it or not, is National Rosacea Awareness Month. Rosacea, what in the world is that? But if you can please explain to our audience, and let's just kick the show off by that.
Sure. Well, rosacea is something that we see quite a bit, and now is a time of year that we start seeing more patients come in the door asking about it. most often patients say that I have a red face, my cheeks are red all the time, or I go out in the sun and then I come home and I look at my face and it's just cherry red, or I keep getting these pimples that pop up for it. But rosacea also includes types that have irritated eyes. So you're like, well, it's not really allergies, but my eyes are always red and feel like they have sand or grit in them. And you may see some people, usually guys who have those really large noses, that's called rhinophyma, and it's another type of rosacea. But it's a chronic condition. We know that it's related to chronic inflammation in the skin, and we think that it's related to a mite called Demodex. So these are all things that combine in to create this redness, and it's not just a blush. You see a handsome person, or you maybe feel a little embarrassed for something.
Yeah.
But you get red on your cheeks, and it goes away after a short while. But with rosacea, that flushing actually stays in place. That's why we call it flushing and not blushing.
I see. That's a good distinction. Well, Dr. Carter, who does it affect? Is it a certain skin pigmented person, or who gets affected by rosacea?
And the thing about rosacea is that it really can affect anyone. So about 16 million Americans have rosacea.
Oh, wow.
And so that's quite a few, and it's probably underdiagnosed in skin of color just because it's not quite as obvious. We may not have as much redness so much as it's violaceous or purplish color, or we really just diagnose it as acne. It could be something completely different that we're thinking that it is. And so we see it quite a bit. It's very, very common.
Is it painful? What are some of the symptoms?
Well, besides the gritty eyes, I've not had any patients complain of pain.
Okay.
But from a symptomatology aspect, we are looking at this itchy, creepy, crawly sensation on the face that is often associated with the higher mite content, that Demodex mite on the skin. It also can have a very sensitive profile to your skin. So you put on a cream that your friend could tolerate, but you put it on and you just can't use it. And sometimes it's just itchy and tender, but it's usually not super duper painful.
Gotcha. Well, that's somewhat.
It's good. It's good.
Well, how in the world are we going to treat rosacea, Dr. Carter?
Well, that's a great question. And there's a wide range of things that you can use for rosacea. But let's talk about prevention, if you don't mind, just stepping back, because I really feel like understanding what to do to prevent a disease is just as much as we need to, we need to know as much about that as we do about treatment. So prevention. When I call it the good things in life syndrome, and I know that bites, but the good things in life are some of the things that can make it worse. So hot foods, spicy foods,
really?
Yes, extremes of temperature, like you go outside and it's 1,000,000 degrees in Dallas, and you go inside and it's cold, and you go back out in the heat and there it is. Or you get in the shower and you hop out and you look at yourself in the mirror and it's stuck there. Red wine can do it. Sometimes it's just alcohol in general, but red wine in particular. And then the sun, getting sun exposure. Again, we're right here in Dallas. We're in, it's that sunny time of year. We're all trying to get outside and have a great time. And so we can see that rosacea get worse. So things to make it better are, one, identify which things make it worse for you, because they all don't apply to every single person. So I tell people, go on an elimination diet. Maybe don't eat the hot tortilla or the spicy fajitas, or don't have all the alcohol, maybe cut down for this week, and then see if that makes things better, and then add things in one by one. So that is what, and then wear your sunscreen. That's always important.
And so you mentioned sunscreen. Is that part of the treatment also in addition to prevention?
Absolutely. So again, it's treatment and prevention. We're trying to prevent you from getting worse, but also allow what's there to not, we're trying to prevent you from getting worse, and prevent it from popping up and flaring the way that it has been. So as far as SPF, so SPF stands for sun protection factor, and it is a measurement of how long you can be in the sun without burning. So the higher the number, the better protection you get. There is a cutoff. Once you get past about SPF 30, 40, really there's not that much difference in the strength of the SPF that you're getting.
That's
and I'll
not what
touch
the
that.
stores or the store prices tell you, but just
Right.
putting it out there.
Right. But here's the thing to remember about SPF. And we're getting, just to go on that tangent a little bit. With SPF, if you were to, most people do not put on enough to achieve the protection listed on the label. So I tell pretty much all of my patients, except for my son, who applies a lot of sunscreen.
Yeah.
But if most people don't put on enough to achieve the protection listed on the label, so get a higher SPF so that when you put on a fraction of that, you are still getting an SPF 30 or higher protection. So
that's a very good point. And I guess we can segue, right? Because we're talking about rosacea, very common skin condition. She mentioned prevention mechanisms and treatment with sunscreen. But sunscreen, we're going to segue into sunscreen. I always associate that with skin cancers, or really prevention of skin cancers. And I know that is a very important topic in the whole world of dermatology. Can you tell our audience about just skin cancers and mainly also prevention of skin cancer?
Well, as we talked about, sunscreen, everybody should have sunscreen as part of their general good skincare regimen. Just add it in, get a moisturizer that has it in there, something that you're comfortable with and that doesn't make your skin look chalky.
Yes.
So that's very important. But skin cancer, we know that probably 90% or more of skin cancers are caused by some degree of sun exposure over the years. And if you look at the amount of sun exposure you get in a lifetime, we used to say most of your sun exposure occurs before the age of 18. Now we know about every 20 years you've incurred about 25% more of your lifetime sun exposure by the time you've hit age 78 to 80. So we want to make sure that sunscreen is a lifetime, or sun protection is a lifetime thing that you're incorporating into your children and grandchildren all the way up until you are a grandfather or grandmother and beyond. As far as the incidence of skin cancers, skin cancer is more common than any other cancer you can think of. Sorry about kidney cancer or lung cancer, colon cancer, breast cancer. We see those in the news. We have family members who have them, and we know that they are devastating. The skin cancer is more common than all of those. With that said, skin cancer is very, very curable. We can cure almost all skin cancers if we catch them early enough. But in skin of color, like yours and mine, we do have to keep in mind that sometimes it's not in the back of our minds that we could have skin cancer because it's not nearly as common. So when we see things, we want to make sure that we're getting stuff checked out. I see lots of patients who are like, I have this new line in my nail. What is that? I have this spot on the bottom of my foot. What is that? We need to ask those questions because in skin of color populations, the survival rate for, say, a melanoma might only be 2/3 at 5 years. So 60% or 67%. Yes, because it's caught later and it's in a more dangerous spot because we don't expect it to be on the bottom of our foot. Bob Marley died of skin cancer, melanoma on his foot. So, he's not the person that you would think of to have skin cancer, but it's that location that is more common in patients with skin of color. And it's the fact that we just don't detect it nearly as early, whereas 92% of patients of Caucasian descent have a 5-year survival rate with early detection of melanoma.
Wow. Thank you. That statistic is shocking. How about now? So sunscreen is the way to go for several, it looks like, skin disorders, especially when we talked about rosacea and skin cancer. But now that everything's, go green and organic and, what are processed products in there? Moms are all freaked out everywhere.
Yes.
So what do we look for? What do we need to be aware of in these sunscreen products?
Absolutely. Well, there's two different sides of things to worry about when it comes to the safety of skin cancer. Like you said, go green, the environment, but then we also need to think about ourselves too, of course.
Right.
So Octanoxate and oxybenzone have been probably the top two that have been in the news. Oxybenzone was found to have decently higher levels in the blood from applying it to the skin. And it's thought to disrupt hormone production in the body. And so when we have little kids, we want to be careful about disrupting hormone production. Even in adults, we don't want to do that as well. So it's one that we tend to stray away from, and it got a lot of press a couple of years ago, and so you won't see it nearly as often, if at all, inside of sunscreens.
Okay.
Now, Octanoxate and Oxybenzone, that's where we're talking about going green. Those are two ingredients that have been banned from sunscreens in Hawaii and other places that have coral reefs because they actually harm the reef and the life that surrounds that reef. So you want to look for sunscreens that have more of a mineral protection, and minerals like titanium and zinc. So titanium dioxide, zinc oxide, you can get these micronized, so they're really, really tiny, and they don't look chalky on your skin, because titanium dioxide, many of you, and zinc oxide, you may remember those as Desitin, your baby ointments and things. Yes. And you might remember the paste that was put on lifeguards' noses, that white paste. Well, now it doesn't have to be white. You can get one that looks good on your skin and blends in very well.
Very nice. Would you like to wrap up on skin cancers and sunscreen?
So, skin cancer, first let me tell you about how to detect skin cancers. So we call it our ABCDEs. So I add E, some people don't have E. So A is for asymmetry. If it is not a nice round circle, then that should make you question things. Borders, if the borders are irregular or blurry, they kind of blend into their side, into the surroundings, or one side just looks fuzzy, then that might be something to prompt you. C is for color. And that's not only for stuff that is really, really dark, it's for stuff that may have started one color and now it's starting to change to another. Or you have a mole and it gets a halo light circle around it. That tells its immune system trying to eat it up for some reason. D is for diameter bigger than a pencil eraser. So pencil eraser is usually pretty easy. These days, maybe a stylus point since we don't use as many pencils. But that gives you an idea what size to say, okay, this is kind of weird. And E, there's a lot of different terms that are placed under E for evolution, or I say everything else. If it makes you uncomfortable, please come see me. If it makes you itch, and that's the only one that itches on you, let's take a look at it and make sure that it's supposed to itch, or whether we need to take it off. If it's bleeding, if it's just looking weird to you, I've had patients come to me and say, that one it doesn't make me feel good inside. I can't sleep at night. Or my dog licks it. Yeah. I've taken them off and they've been melanoma. Follow your instincts. Don't be afraid to ask the question.
Exactly. Thank you. A, B, C, D, E.
Yes.
Very important, guys. And especially summer is coming. We're in Texas. The sun is blazing. I mean, if we had snowvid, God knows what's going to be the summer like. I don't know. So we're talking extremes.
Right.
And either way, we're in Texas. So please, everybody take sun safety precautions. I'm going to switch gears here. And Jasmine Garcia, thank you. She's on Facebook Live, and she asked a question. She is regarding psoriasis. And Dr. Carter will explain what psoriasis is, but Jasmine is asking, what is the best treatment for psoriasis nowadays? She used to be on Otezla, but stopped it this year because COVID started, and because she was just scared that the immune system would be weak from taking it. So if you can explain, because psoriasis is something commonly we see in the medical field. A lot of patients, a lot of individuals have psoriasis. So if you can explain to our audience what psoriasis is.
Well, psoriasis, first off, is something that is kind of near and dear to my heart. It's one of the reasons why when people ask me, why did you go into dermatology? My mom has psoriasis. She's been affected for many years. And I've been able to walk her through a lot of the different treatments and options. And so it's been an honor to be able to do that for her and to also walk patients through it. So Jasmine, as far as psoriasis goes, psoriasis is an inflammatory condition that is set off by your immune system. And so it just means that some portion of your immune system is turned up a little bit higher, such that it is accelerating the process through which the skin cells grow. They grow more rapidly, they divide very quickly, but they don't break off and formulate dust on your furniture as quickly. They all stay stuck on your arm or on your body and make those thick white flakes. It's not contagious, so but it can be uncomfortable. Sometimes in folds of the skin, it can be very, very raw and tender. It can be itchy, and sometimes it's just, it's not the most beautiful condition to have if it's on your scalp or it's just uncomfortable and forms flakes on your shirt and things. So psoriasis also very, very common. You asked about treatments, though. We have a lot of different treatments. Of course, if you've gotten to Otezla, you've probably been through our topical treatments, the topical steroids and the anti-inflammatories. Some people have done phototherapy, and I know we just went through a whole segment about avoiding the sun, but in some instances, in some patients, treating you with prescribed phototherapy, going into a light box, can help. Otezla is one of the pills that is available, and there's several pills that all switch around, and we call it immunomodulation, not immunosuppression, but immunomodulation, where we're slowing down the portion of your immune system that is overactive. And so the Otezla does that in one way. It works very well. And there are other medications that are more injectables, and they stop or slow down some portion of your immune system that is promoting this psoriasis. And a lot of them are the ones that are out today. You may hear of Humira and Tremfya and Cosentyx and Illumia and Saliq.
If you watch TV,
Yes, if you watch TV, you see all of these. Skyrizi, there, Stelara. I'm trying to name all of them so we're not biased as well as I can. But there are a lot of them out there, and which one fits your needs depends upon what you have. Psoriasis is not just an inflammatory condition of your skin. We have to think of overall inflammation in the body. Psoriasis, up to a third of patients can have psoriatic arthritis. And it's a destructive arthritis. Once you get it, it can start eating away at those bones, and we cannot get those joints back. So for a patient who has that, we're probably not going to stop treating you, or just start with treating you on a topical medication, a cream. Now we're looking at something like Otezla or something like one of these injectables to help you out. But I do want to mention, I know you were concerned, Jasmine, about COVID and the Cova Vaccine. And trust me, we as dermatologists, we are very risk averse. And we do not want to do anything that hurts the patient. I say all the time, it doesn't matter what your skin looks like if your liver's not working, if your heart's not working, if your immune system's not working. But I will say that we really have looked at the data and the safety, and I would recommend that anybody who has questions, definitely talk with your physician. But the vast majority of people who are on medications for psoriasis can indeed continue them, and you can get your COVID vaccine.
Awesome information. Thank you for letting us know that. Thank you, Jasmine, for your question. Thank you.
Yes.
So, what else is going on around this time of the year? Allergies, Dr. Carter, as you well know. And so we've noticed our child, especially my son, his allergies are bad this time of year. I feel like mine is worse in the fall seasons, but we also notice skin changes happen with allergies. And can you discuss some of those common skin issues with that?
Well, this kind of brings us in a little bit of a circle, because sometimes these skin allergies and changes look a lot like rosacea. So sometimes we have to, if you need help, see a board-certified dermatologist to help you distinguish between the two. And if we need to do treatments for rosacea, whether that's creams, or we have some pills that work, or there's a couple of lasers and light treatments, or now we may need to go down the irritation, inflammation direction of treatment. So we see a lot of eczema at this time of year. And patients who have eczema are at higher risk for developing other types of what we call atopy. So eczema, another term for it is atopic dermatitis. But under that category, we have asthma and we have hay fever. And frequently we find patients who have the same or those three conditions, whether it's all in the same person or they have multiple ones in the same family. Using myself as an example, I have asthma. I had eczema as a child. I also have hay fever. I didn't develop that until my teens when I lost the eczema. So, but it's I kind of compare it to being the same problem, different organ systems. One's in the lungs, one's in the eyes and the nose, and then one is on the skin. So eczema is a sensitivity to the environment. Sometimes we know what it is, sometimes we don't. But keeping your skin barrier intact with moisturizer and keeping it clean is the number one. That's your basic start for treatment.
Got it. Thank you, Dr. Carter. I have so many more topics that I want to discuss, but believe it or not, guys, we are nearing the end of our show.
Wow.
I know. But guys, folks, remember to check us out on Facebook, Instagram, Twitter, our website, Doc Talk Live, our YouTube channel, and then also our podcast, which can be found on Spotify and Stitcher. I want to thank you, Dr. Carter, for being on the show, volunteering your time. Please tell our audience how they can come find you once again.
Sure. Well, again, thank you so much for having me on the show again. It's such a pleasure to be here. If you need me, you can find me on my website at www.affinitydermatology.com, or you can find me on Facebook, Twitter, or Instagram at Dallas Skin Doc or Affinity Derm, at Affinity Derm. And I hope to help anybody who needs some help. If you have any questions, please shoot them at me and I'll help you as best I can.
Thank you so much, and we thank you, our listeners, for being with us here on Doc Talk Live every week. Thank you, Facebook Live, for sending in your questions. We'll be here next week. Stay healthy, America. It's Dr. Simon signing off.